So, a big part of your message when it comes to oral health is to optimize the microbiome there. Hence the name of your company, FYGG, Feed Your Good Guys. We know now that xylitol is great for the oral microbiome and the nasal. What else can we do specifically in those two areas to optimize the microbiome?
There are certainly other areas. It's not just diet. It's not just oral care products. So we talked about that. Diet, optimize that. Oral care products, make sure that everything is oral microbiome friendly. Most are not. The whole industry for the last century has been based on disinfecting the mouth. I think that message is getting through to people. And then the other thing, another big issue or factor that we have control over is the pH of saliva, the consistency of saliva, the amount of saliva in the mouth, and that relates back to how much mouth breathing we do. Unfortunately, there are bigger picture issues in our species as we, in the last second of our existence, we have become agrarian and our lifestyle has changed dramatically, so much so that we're just beginning to notice it. There's a great quote on that. I'll try and find it on that timeline. But the majority of our time, 99% of our time on this planet has been eating a certain diet. And it's just the last 1% where we've changed it drastically. And now we're beginning to see the signs of, or the ramifications of that. And one of them is facial development. So because facial development is off, we're breathing through our mouth, which is drying out our mouths. We lose a liter of saliva. I mean, it's no wonder electrolytes are so popular, and hydration is so important, has become so important. Our mouths are always open when we sleep at night, for example. That's the easy target. You're sitting there for 6, 7, 8 hours, hopefully 7 or 8, and your mouth is open. You're losing a lot of moisture. If you're getting up in the middle of the night, your mouth is dry, you're thirsty. If your mouth is very sticky in the morning, and the first thing you want to do is deal with that thirst or the quenching your thirst kind of response. That's not really normal. Obviously, you should drink a lot in the morning because you haven't had anything for 7 hours. But we lose a lot of moisture through our mouth. In doing so, the oral microbiome is affected. The oral microbiome needs the body of saliva. It's a communicator. It's transport. Essentially, it gets it to the biofilm. It gets it to other parts of the mouth, or all these little niches in the mouth that have different types of environments. We call those the micro niches, or the niches of the oral microbiome in the mouth. The nasal biome is a niche. So saliva has to be present for the oral microbiome to be doing its job. And as soon as you start losing that saliva, your pH drops. And if you start moving the needle down to a negative pH, an acidic pH of 2, 3, or 4, even 5, different bacteria colonize, and they tend to be the more virulent ones, the bad boys, and not the good guys. And that's they're always there. The bad guys are always there, and sometimes the bad guys have good functions when they're in check. Again, it's very complicated, and this is where AI hopefully will help us nail down what goes on in the mouth with the oral microbiome. But you need a stable pH, and if you're mouth breathing a lot, it's not going to happen. If you're talking a lot like we are for the next hour and a half, you should be sipping water. You need to replenish. You need to be well hydrated internally. If you are dehydrated, one of the first things that happens is your mouth gets very parched. You're not producing saliva. If you're always thirsty, or let's say you're in the desert and you haven't had water for a day or two, probably less than that. A day or two is pretty serious. We really can't do that well. Guess what? Your body shuts down the saliva glands. And then the oral microbiome basically suffers. It becomes just a cesspool. And then you get oral ulcerations. You get bad breath. Your tongue starts cracking. Your lips start cracking. Your nasal biome has issues as well. So that would be the third big category, is how are you maintaining your hydration and how it relates to how much you're losing, how much moisture you're losing. And one aspect would be, mouth breathing. So it's important to breathe through your nose. When you breathe through your nose, you're humidifying things. You're not drying out. You're not taking away moisture in the mouth. In fact, you're humidifying the air before it goes into the lungs, which is a wonderful thing, and warming it as well.
Now that you're done, you're going to want to stick around here and catch this other incredible episode. You don't want to miss it. I'll see you over there.
We use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. So a lot of people are going to their dental offices. They're saying, take them all out.